Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again for another segment. The population over 60 years of age is expected to double to about 22% by 2050. We're talking about 2.1 billion people over the age of 60. Now, our guest this morning is Dr. William Haseltine. He's joining us to talk about his book, Aging Well. Now, this book looks into ways to support the health and well-being of older adults and also offering caregivers and policymakers and healthcare leaders insights into basically reducing health spending, especially by means of workflow and novel digital health technology. Welcome to the program, Dr. Haseltine. Thank you for taking the time this morning.
Well, thank you. It's a pleasure to speak with you this morning.
Now, I did, of course, mention that we're talking about the aging population. Give us a bit of background about yourself as president of Access Health International.
I've had a interesting career, a fundamental research scientist working on a number of topics, cancer and AIDS. I've had a career in business, creating biopharmaceutical companies, and there are 8 products in the market from companies I've helped to create. And over the last 15 years, I've been focused on improving healthcare systems, both in this country and around the world, through a foundation I created, Access Health International. AIDS, not AIDS, but aging is one of the major unsolved problems in health. When I look at aging as a healthcare problem, I see it not only the United States, but the world as being woefully unprepared to deal with what's coming.
What is coming? We all age. Are we talking about a day when we don't age, or are we talking about aging in such a way that it isn't a healthcare problem, is just an aging issue?
When I look at it as a healthcare system, I look at it from both the individual's point of view and society's point of view. Let's take the second one first. From a society point of view, it's a major problem if there are more older people than younger people. Most older people aren't contributing economically to the society. They depend on younger people for financial support. And if that population pyramid is inverted, so there are more older people than younger people, that's a problem. That's happening in a very dramatic way in some countries. I call it the lollipop phenomenon. If you look at the population of Italy or Japan, for example, there's a very narrow base of younger people and a very big base of people who are older. That's a double problem because older people have a lot more health issues than younger people, and they need more care. So that's the first issue. The second issue is almost everybody who's listening knows what I'm talking about. If you're a spouse, are you taking care of a very ill person? If you are an adult, are you taking care of your parents? Or are you also taking care of some of your children who may have disabilities? You may be taking care of both, as a matter of fact. Now, as an older person, it's very difficult to know what to do. How do you keep yourself healthy? What kind of doctors do you see? We as a society aren't really prepared to deal with what we are beginning to experience, and certainly what is coming.
We spend a lot of money here in the United States, other countries as well, but here in the United States, we spend a great deal of money. Why are we lagging when it comes to this pyramid, this aging pyramid?
Well, we're doing better than some countries like the ones I mentioned, Japan, and because we have immigration, and immigration has been a powerful demographic force for us. People who've been in this country for several generations aren't having children at a replacement rate, but people who've come into this country more recently are. And that's put the U.S. in a relatively good position, but not a great position in terms of what's coming. And as immigration slows down, the problems become more acute. There are a lot of things that can be done, both from a health systems point of view, from an individual point of view. If you're an individual looking at what you might do, Our book, Aging Well, gives you about 10 things that you can think about doing that can make you and your parents or your spouses much happier as they age. As a country, we look at what we can do to restructure our healthcare systems so that we deliver much more care at home, in communities, and that we integrate social care with medical care. There are many things we can do, but I don't see our country, or almost any country, really addressing this problem in a systematic way.
And speaking of your book, Aging Well, Chapter 2 talks about person-centered care. What is person-centered care, and why is this and value-based care so essential?
We want our healthcare system to focus on us. But to me, person-centered care is a lot more than that. I mentioned just a minute ago integration of medical and social care. What that means is having social services part of medical care, or put another way, have medical care part of social services. Your social services generally know you as a person. They know where you live, they know your family, they know your needs. Medical personnel very often don't know that. They know you as a patient, not as a person. I believe it's critical to integrate social care and medical care. And that way, if you have a combined record of your social status and your social needs and your medical needs, you can treat people in a much more holistic fashion for what they need as a person, not what they need as a patient.
Now, there has to be some type of, balance is what we're looking for, that balance of what they need as a patient and what they need as a person, because aren't there many cases where no matter what they need as a person, a certain medical approach is necessary for their health and well-being?
Absolutely. You're 100% right. I'm not advocating to eliminate medicine. I'm advocating integrating social care and medical care so that we really understand the person's needs and what they are. Let me give you an example. Suppose you have a person with a chronic issue like diabetes. A social worker will know where that person lives, will know what that person's weight is, will know what that person eats, and may be able to inform the medical part of that person's care about those issues. They may be able to work together to prevent the diabetes from getting worse. Whereas if you're only dealing it from a medical perspective, you're only seeing a part of the picture. You're not seeing the whole picture. And that's what I find as I look around the world. For example, take one of the best healthcare systems in the world, Sweden. They have a terrible time trying to integrate social and medical care. However, the neighbor country, Finland, has just created a program where there's a government agency, which is the agency for, or the ministry for social and medical care. And they're doing everything to integrate those records and to integrate the care. I think that can make a really big difference to individuals.
How is Access Health International working toward that end?
Well, what we do is we're, in the first place, a think tank. So we look all over the world for the best examples of elder care, dementia care, or any type of care. That's the first thing we do. And that's the result of these books. I've got 3 books out now: Aging Well, Voices in Dementia Care, and Stay Young Navigators. They've just come out. That's our think tank work. Second part of our work is advising governments, advising U.S. government, advising governments around the world. We have offices all over the world. And advising governments that have decided they want to make a change to help them do that better. And in some rare cases, the governments will ask us to help implement certain programs. Like in India, the Access Health in India is helping develop digital care systems for the entire country. So we're actually helping implement in some cases. But we only help where we're asked. We don't offer, we offer to help anybody, but somebody has to ask us, please help us use your knowledge to improve our health system or the way we are working with our elder populations.
Give our listeners a website, Doctor, where we can go and get some more information about Access Health International and learn how to possibly get involved or even on a local level when it comes to integrating social services and medical services. Where can we go and get some more information?
Well, I think, let me just give you our website. It's www.access, that's normal word access followed by the letter H.org. www.access.org. And that's a good place to start. You can write us and we'd be happy to direct you to more local agencies.
And obviously we can get links to your books as well at that website.
Right. Amazon is a great place to get these books, either as a hard copy or as a digital copy.
Thank you so much for joining us here on Health Professional Radio. Been quite eye-opening, and I'm really hoping that we'll get to talk again and learn some more about how to age well here in the United States and abroad.
Thank you very much for your time.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this conversation are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.